Do you know what gives us energy to carry out our daily activities? You know it. We have read it in our school books. It comes from the food we eat. This food breaks down into a type of sugar, called glucose, which enters the bloodstream. Then, the pancreas produces a hormone called insulin depending on the amount of glucose in the blood. It is this insulin that commands the cell doors to open and let the glucose in. Once inside, the cells convert glucose into energy. A healthy body has a constant balance between glucose and insulin levels. What happens when the body stops making insulin, produces it insufficiently, or is unable to utilize what it produced? One word: diabetes. Diabetes can be of different types. Type 1 and Type 2 diabetes are the two most common forms of diabetes mellitus, and they can lead to several complications which can be based on severity. For a person with diabetes, the focus is to constantly control the amount of glucose in the body so that it stays as close to the normal range as possible. For this, some patients may need just oral medications like metformin, while some may need injections or even insulin shots, not all inclusive. Hence, it is important to review each diabetes case carefully before capturing its diagnosis codes. Let's see some examples. Consider the case of Roman, a type 2 diabetic patient with stage 4 chronic renal disease, who takes insulin daily. To code this scenario, refer to the ICD-10 guideline for diabetes with rule. Here, chronic kidney disease or CKD is linked to diabetes. Hence, the with rule would be followed and E11.22 should be reported. The note under code N18 indicates insulin Z79.4 is assigned. Consider another case of John, a type 2 diabetes patient, examined for a chronic diabetic right foot ulcer. In this case, ulcer is a non-chronic condition supported in the physical exam. Hence, the with rule is applied and E11.621 would be assigned. An additional code, L97.519, would be assigned to identify the place of ulcer. Finally, let's look at Lily's case, who is a type 1 diabetic patient. Would it be appropriate to assign the code Z79.4 for this case? As per the coding guidelines for long-term use of insulin, it is not necessary to code Z79.4 for type 1 diabetes, as it is an inherent part of the disease. Whether you are an experienced coder or new to coding diabetes, it is important to take your time to review the medical chart. Look for the key indicators such as the type of diabetes, presence of complications, and treatment plan to assign the correct diagnosis codes.